Hi, I'm Dr. Flora Waples, founder and medical director of RESTOR Medical Spa, and today I'm going to answer the top 5 most common questions that I get about Botox. People ask, what is Botox? It's a great question. Botox is a medication that relaxes muscles when it is injected. All of the aging of the upper third of our face, lines here, and lines around the eyes, are caused by muscle contractions that pull at the skin and break the skin down over time. When we inject a neuromodulator like Botox, Dysport, or Xeomin, that medication acts to relax the muscle. When the muscle relaxes, line goes away. Even better, it prevents new lines from forming. Question number 2, why do we need it? Again, another great question. The answer is because all of the aging of the upper third of your face, here, and here, is caused by muscle contraction. It can only be solved by muscle relaxation. And that's what your neuromodulators do. Botox, Dysport, Xeomin, Jeuveau, all of them work by relaxing the muscles, which causes the lines you have to go away and prevents any new lines from forming. Question number 3, how does it work? Neuromodulators work by sliding in between the place where the nerve and the muscle meet, a place called the neuromuscular junction. They make it impossible for the signal from the nerve to get to the muscle. So even if the nerve is firing, the muscle stays relaxed. It's a wonderful medication. Question number 4, how do I know what I need? Well, go ahead and just look in the mirror. Any lines that you have here across the forehead or around the eyes, those are lines that we can treat with a neuromodulator like Botox, Dysport, or Xeomin. If it gets worse when you make expressions, that's a Botox line. We can stamp it out if you want us to. Come on in and see us about that. 5th and final question, when should I start? Another great question. Generally speaking, muscular aging of the upper face will start to show in the mid-30s. You'll start to see your first lines here, your first times here. Usually early to mid-30s is when that starts. But the fact that that's when you see the line does not mean that that's when the process that formed the line started. So when I tell my patients, I say, listen, you're probably going to want to start doing tox sometime in your mid-30s. However, if you want to prevent those lines from starting in the first place, start with preventative tox in your 20s. They never get a chance to form if you relax the muscle early. And those are the top 5 questions that I get asked most frequently about tox.